We are often asked, Doctor, how do we make a V-shaped jawline? Hi, my name is Dr. Arun. I'm a facial cosmetic surgeon. And we are often asked by patients, I want a beautiful looking V-shaped jawline, especially the females, and how do I achieve it? Okay, first we got to understand that a V-shaped jawline is a typical female feature which makes a female look more feminine or more softer. Now, when we want to achieve a V-shaped jawline, there are non-surgical modalities and there are surgical modalities, and there are mixture of these two modalities. So, not that always we need to go in for surgery, and not that we always have to, kind of go into the non-surgical modalities. Sometimes we need to, add up together to achieve good results. Now, what are the modalities we are looking at? So, when we're talking about making a V-shaped jawline, first thing is we have to understand that we got to make our face slimmer. That is the lower third of the face, it should be slimmer. So, how do we do that? The first thing is basically we have to understand there is a muscle called masseter here, which makes the jaw look bulkier and more squarish. So, this needs to be settled down, and this needs to be, kind of reduced to make the face look more slimmer. So this can be achieved by two ways, either non-surgical modality or the surgical modality. Non-surgical, non-invasive modality includes botulinum toxin injections into the masseter muscle. When we inject that, over a period of time, what actually happens is the muscle starts slimming down. The surgical modality includes a surgery wherein we can resect a part of the masseter muscle, which gives the bulkiness to the lower part of the face. So once this slims down, either we use injections of botulinum toxin or a surgery, so this lower face starts slimming down. Another component of your lower third, which looks bulky, is basically your buccal fat. It's a minimally invasive surgical procedure wherein we can, kind of take out the buccal fat from inside your mouth. There is no scar involved. The downtime is very low, but then that actually reduces the bulkiness of the lower third of the face. So to reduce your lower third of the face or slimming down, which many patients ask for, we need to be taking care of your masseter and taking care of the buccal fat. All right. So once we have done that, we need to create a V-shaped jawline. The first thing we have achieved is slimming down the face. Now coming to the anterior aspect, we need to have a very nice chin here. Many of the patients have wider chin. So this chin can be again augmented by dermal fillers, thick volume dermal fillers, which can augment this area, or we can do something called as a genioplasty, wherein we resect the bone and bring it forward, or we can add a silicone implant here to make it as a V-shaped. So once we do that, this becomes very prominent. This becomes nice and prominent. Many of the patients, especially females, they have a very strong jawline here, which is very, it's something like a perpendicular jawline, which does not give the typical V-shaped pattern for a female. So what we do is a surgical procedure wherein we go from inside the mouth and we cut the angle of the lower bone, or it's called the mandible. We resect it here, and once that happens, there is a smooth flow of the jawline which comes from here all along and it becomes a typical V shape. Another thing which we have to understand is, once we have created a nice jawline and we have also slimmed it down, sometimes some patients have got this submental fat which actually does not give definition to the jawline. We also need to take out this submental fat by doing a submental liposuction, which is again can be done under local anesthesia, wherein we make a small incision from here and go deep into this area above the platysma and take out the fat from there, and this heals nicely and the fat goes off, which creates a very nice jawline here. So if you want to combine and summarize the whole thing, how do I create a V-shaped jawline? Number one, we have to slim the lower part of the face, which includes the masseter reduction and the buccal fat removal. Creating a jawline and making a chin, nice prominent chin, we can do a filler, which may not be as good as a genioplasty or a silicone implant. Reducing, if there is a vertical or there is a perpendicular angle, we can just reduce it by using a piezo surgery. We just cut this off and this becomes a typical V-shaped jawline. And to create a more visible jawline, we have to take out the submental fat, which can be done again under local anesthesia. A combination of these things, as I mentioned, non-surgical and surgical modalities, we can achieve a beautiful V-shaped jawline, which is going to make you look much younger. If you have any queries or if you want to understand more about this, please get in touch with us and be more than happy to help you out. Thank you so much.